My name is Jackie Skidmore, and I'm the director of the Usdan Institute for Animal Health Education here at AMC. We're so pleased to have AMC's Dr. Alexandra van der Woerdt here with us tonight. She is board certified by both the American and European Colleges of Veterinary Ophthalmologists. She came to AMC in 1994 and currently heads our ophthalmology service. She also serves as a director of postgraduate education at AMC, shepherding our interns through their very confusing and difficult intern year here. She's received several honors and awards, including the Clenendon J. Ryan Memorial Teaching Award in 2001, and was named Veterinarian of the Year in 2006 by the New York City Veterinary Medical Association. She received the award for outstanding service to veterinary medicine from the New York City Veterinary Medical Association in 2015. We're very grateful to have her speaking here tonight. So without further ado, please welcome Dr. van der Woerdt.
Thank you everybody for coming. It's always great to see so many people. I see quite a number of faces that I recognize. And then there's of course new faces, so that's very good. You can't hear me? Okay. Well, I guess I'll just have to scream a bit more. Can you hear me now? It sounds like the Verizon commercial, isn't it? Can you hear me now? Okay, so tonight we're going to talk about cataracts. And cataracts, a lot of what I'm going to say is going to be the same whether it's a dog or a cat. Most slides will be about dogs, and in the end I'm going to say a few specific things about cats. But pretty much whatever's on each slide can apply to both dogs and cats. So I first like to introduce my team at the ophthalmology service. This picture was taken after a very long surgery day. But there's myself, in the middle is Thomas Hall, my technician, and then on the other side is Pete Pineda. He's a recent addition to our team, and he's an assistant. He's been amazing as well. So anytime you want to get a hold of us, you'll probably get either one of the three of us. I also have to immediately say that I am not the best in taking pictures. I tend to forget. So I actually honestly contacted one of my colleagues who is on Long Island, Dr. Lacroix, who is much better at remembering to take pictures than I am. So some of the pictures in this presentation are actually from her. So what are we going to talk about? Well, there's a number of things we're going to talk about. First, we're going to talk about the anatomy of the eye. The various structures within the eye, what are they and what is their function? And then after that we'll talk a little bit about a cloudy eye, because there's many reasons for an eye to be cloudy, not just a cataract. Then we talk about specifically about cataracts, for the causes and the stages of cataract formation, the treatment of cataract, the aftercare after cataract surgery, success rate, possible complications of cataract surgery in dogs and cats, and then a few specific things about cataracts in cats. So we talk about anatomy of the eye, and here's a very schematic drawing where if we look at it, we've got here the eyelids of course are not on this picture, but then the conjunctiva is the tissue that lines the eye. The cornea is right here. There we have the iris, we have the lens, the vitreous, which is like a gel, and then back here is the retina and the optic nerve. The eyelids. The eyelids are very important to help protect the eye. And the reason why I put this picture here, because as you can tell, these eyelids do not do a great job protecting these eyes. That's of course has got absolutely nothing to do with cataracts, but it's just something that when I was thinking about the eyelids and their function, I'm like, yeah, the eyelids are very important to keep the eye protected. They blink, of course they're supposed to blink, they spread the tear film, they remove foreign material that comes into the eye from the environment, and they help, like I said, they help protect the eye. The animals do not have eyelashes like people do. So sometimes we talk about something that's called the stichia, which is extra eyelashes, and the reason why we say they're extra because dogs don't really have eyelashes like people do. The hairs start a little bit away from the eyelid margin. The eyelids do have multiple glands that secrete part of the tear film. It's kind of a waxy, fatty substance that is part of the tear film. The conjunctiva is the tissue that lines the eye. It is normally transparent with a very few blood vessels. If it becomes inflamed and red, we have what a lot of people would refer to as pink eye. It's a very common thing, both in dogs, cats, people, we see it all the time. And that inflammation can be because of very many different reasons. It could be that it's just an allergy to something. Or maybe an animal could have gotten something in the eye and it just irritated the eye and that's why it red. But it can also sometimes be a sign that there's something much more significant going on inside the eye. So redness of the conjunctiva is something that can be just very harmless, but potentially it could have disease, it could be associated with more significant diseases as well. This dog does not have normal conjunctiva. It had a lot of extra fluid buildup under the conjunctiva because of an allergic reaction. The cornea. The cornea you typically actually don't see because that's a completely transparent structure that is in front of the eye. And this was actually a picture from a previous greyhound of mine. And as you can tell, the cornea is here, but you don't really see it because you see the iris here, you see the lens here. This is his third eyelid. And that's the way it's supposed to be. The cornea is supposed to be completely transparent. It's not supposed to have any blood vessels. It's supposed to be completely transparent. It's a very delicate structure. And that's one of the reasons why it's so important to have good functioning eyelids to help protect that very delicate structure. And of course, there's lots of diseases that can affect the transparency of the cornea. And the reason why that's actually important for a cataract surgery lecture or a lecture about cataracts, because kind of jumping ahead, if we're going to potentially do surgery, I'm going to need a completely clear cornea because I'm going to be able to see through it. If I can't see through it, I can't do surgery. And the cornea also, most people don't realize it, but helps to focus the images on the retina. Typically, people always think about the lens doing that, but actually the cornea does that as well. And if you think about it, people that get LASIK or LASIK, that's what they do. They change the cornea so that the light is now focused different onto the retina, and then hopefully people won't need glasses anymore. The iris. Of course, I love this picture of the blue eye and the brown eye. And the iris is an important structure as far as regulating the amount of light that comes through into the eye by constricting the pupil. It's typically round in the dogs, and it's kind of a vertical slit in the cat. Now, as animals age, and this is very common in certain breeds, like for instance a miniature poodle, as they age, it's not uncommon that the iris loses some of its normal tissue. And it really doesn't mean a whole lot, but it does mean that the pupil gets bigger, and there are some animals that actually may become a little light sensitive because of it. It's not common, but it can sometimes happen. But if the iris loses a little bit of its normal tissue and the pupil gets bigger, that means you can also see more of the structures like the lens behind it. And we'll get to that a little bit later. Now we finally get to the lens. It focuses the light onto the retina. It is held in place by these tiny little zonules, 360 degrees. It hardens with age. The lens keeps growing during life. It cannot possibly get any bigger because otherwise eventually all our eyes would explode if it were getting bigger and bigger. So instead it starts growing almost like inside, where it hardens, it becomes more and more compact. As it grows, it kind of just pushes the other material a little bit more in the center. Now that is something that happens in all of us. At some point of time, it doesn't matter who you are, you're going to need reading glasses. I know I have them. And that's exactly what happens in nuclear sclerosis. This lens gets harder. It's not as flexible anymore. And because of that, you're going to need reading glasses. Same thing happens in dogs and cats. They don't need reading glasses, but it does happen. A cataract is a true opacification, and we'll talk about that more. The vitreous is a gel-like cushion between the lens and the retina, and it can slowly become more fluid as the animals age. Now, this seems a very weird picture probably, but this is a vitreous in a dog that has lots of little vitreous floaters. I'm sure there's a number of you in this room who have vitreous floaters. They are very annoying, especially like bright light conditions. I have them. And it's just, again, it's part of like, well, at some point in time you get a bit older and that's okay. But this dog, of course, had very, very significant, it doesn't seem to bother the dogs like it bothers people. So that's a good thing. The retina, it's so funny because we always say it's like the film in a camera. And then I was realizing I have a 14-year-old daughter who has never seen a camera with film in it. So we all know what we mean, but the younger generation, I guess I'm going to have to figure out something else. But it basically receives the image and then sends it to the brain. And then the dog and the cat have a reflective structure in the back of the eye. It's called the tapetum. And that is something that you and I don't have. The reason why, if you don't have the red eye focus thingy set on your camera, you get these red pupils, because we see the structure of the back of the human eye, which is typically full of blood vessels and gives a red appearance. If you think about, sometimes you may see it in your dog or cat at night, where they got to have a little bit this green reflection. Or the deer in the headlight with their incredible reflection. That's this structure, the tapetum, that is doing that. It helps increase vision during dim light conditions. So it especially developed in animals that are more nighttime animals than we are. We come to the cloudy eye. Is it a cataract? Like I said, there's a number of reasons for an eye to be cloudy. There could be either extra fluid, called corneal edema in the cornea. There could be scarring, significant scarring. If you have a lot of corneal ulcerations, scratches on the cornea, every single time that cornea heals, it can leave a scar. So that could be a reason for cloudiness as well. There could also be some material in between the space between the cornea and the iris, and I have examples of all of them. If you have severe inflammation of the iris, that can also look very cloudy. And then if we move deeper in the eye, the cloudy lens, which could either be nuclear sclerosis or cataract. This eye, a lot of people would say like, oh, your dog has a cataract. Well, it actually doesn't, because this is not the lens you're looking at. This is one of the times where you can actually see the cornea. You're not supposed to be able to actually see the cornea because you're supposed to see right through it. But there's extra fluid right here in the cornea. There are some vessels here, and because of that, this eye is so cloudy. There could also be material in between the cornea, and the cornea right here, and the iris. There's a little bit of bleeding inside here, and there could be some inflammation in there as And this is my boy. I got him from the shelter about 11 years ago. They said he was 1, he was probably a little bit older. So he's getting up there in age. And it was so funny because I walked in and I saw this dog. I'm like, that's like my dog. So anyway, he's got some pretty significant nuclear sclerosis. It's a normal aging, again, a normal aging process of the lens. In people, it starts happening above the age of about 40. It's present in dogs after 6 years of age. Cats at an older age, a little bit more variable. Like I said, we need reading glasses. Dogs and cats don't need that, but it can be very easily confused for a cataract in older animals, because it does give that kind of cloudy appearance. It doesn't affect vision significantly. However, I have found over the years that it seems like these dogs that are really getting to be senior citizens. It's not uncommon. They may walk towards their food bowl and then use their nose for the last little bit to actually locate where that is. Also, if you try to give them a treat, it's probably better to pull it a little bit further away from them because they can see it better. If you hold it too close, they may really have to use that nose to try to find it. So if you read the literature, all that stuff is not supposed to happen in dogs, but literature is sometimes not always reflective of what happens in real life, and I definitely do see that. But there's really nothing we can do about it, and it's just something to be expected as they get to reach senior citizen age. So this is him again, in his favorite position, and that's his eye. Well, usually he likes to be right on the couch there, and that's his eye. I mean, it really looks very cloudy. And I do look at him once a year just to make sure he doesn't have cataracts, but he really does not have cataracts. It's just all the normal aging change. And then we get to the next reason for a cloudy eye, a true cataract. A true cataract is an opacification of the lens or the lens capsule. It can be a tiny spot of cataracts, and they're very common in older dogs. If you bring a dog to me that's more than 10 years old, I will probably find a little tiny spot of cataract. No big deal, there's nothing we need to do about it, don't worry about it. But if it starts to affect a large part of the lens, then it really can start to interfere with vision. Like this dog, this lens has a huge amount of cataract, so that really can interfere with vision. So we get to the cataract, the causes of cataract formation. And this is my other dog. This is Hudson, and this is Bella. Hudson, I'm not really worried about him getting cataract. And the reason for that is the number one reason for cataracts in dogs is something in their genes. That really is the most important reason. And he is a pit bull Labrador mix. I'm not worried about it. Her though, she's a little miniature poodle. Oh yeah, she is definitely more at risk than him for getting a cataract as she gets older. So guess what? I'll be checking her regularly as well. There is genetic testing available for many breeds. The age of onset is very breed specific. Sometimes I see in Cocker Spaniels, I see animals that are blind from cataracts before they're 1 year of age. If you have a Bichon, they typically tend to be 4 to 7 years of age. Miniature Poodle, frequently 10 years and plus. So it depends a little bit on the dog breed as to what age they typically start. A common question that I get is my dog not way too young for getting cataracts? And because that's what you think in people. Cataracts, you think something as you age, your grandparents, they get cataracts. But in dogs, because the number one reason is something in their genes, it can happen at a much earlier age. The second most common reason is secondary to diabetes mellitus. And that is more common if the diabetes is difficult to control. There is a study, it's an old study, but it says that about 50% of the diabetic dogs will develop cataract within 1 year of diagnosis of the diabetes, and about 80% of them within 2 years of diagnosis. I don't think honestly it's quite that high, but there is definitely a chance that in diabetes you can get secondary cataracts. And those cataracts secondary to diabetes tend to come on very quickly. Meaning the genetic cataract frequently they develop slowly over months, sometimes years. The diabetic cataract can literally go from having fine vision to almost no vision just a couple days later. Doesn't always happen, but it certainly can. Then there's other causes for cataract as well, secondary to inflammation inside the eye. If you notice, this is not a nice round pupil. That is because the iris is stuck secondary to inflammation. It can also be secondary to diseases deeper inside the eye, certain retinal diseases, Trauma can cause cataract as well. It's really not that uncommon, not that common, honestly. And then there's more uncommon things like a puppy bites an electrical cord, gets over that, but then 6 months later develops a cataract. So there are some unusual reasons for cataracts as well. When we talk about stages, there's something called the incipient cataract, which is basically the earliest beginning. And this is actually a little bit bigger than typically incipient. But incipient would be like a little dot here or a little dot there. And it's a small cataract. It doesn't interfere with vision, and it can go unnoticed. And those are typically the cataracts that we see in dogs as they age. It's just little tiny spots of cataracts, no big deal. We don't worry about them. They can, of course, progress and become larger, and they become more significant. The next stage is immature cataracts, which means that slowly over time, more and more of the lens will become involved. And again, initially, we may not have any issues with vision, but as the cataract grows, you can slowly start to have seen problems with vision. Where initially you might notice that, you know, maybe sometimes he doesn't quite want to catch the toy as well or fetch the ball. And then you go like, hey, he's just getting old, or he just doesn't want to do it anymore. And then at some point in time you might notice, you know, he's walking slower. And then at some point in time you might notice that, you know what, he just bumped into something that he should have seen. And that's kind of like as the cataract progresses, you can get more of that. A mature cataract is a blinding cataract, meaning there's light that comes through, but no real vision, and the entire lens is involved. At that point in time, that eye is blind. A hypermature cataract is something where the lens starts doing when a grape turns into a raisin. It starts shriveling up. And sometimes, especially in young animals, it can actually do it to the point where you can start to see the reflection of the back of the eye again, and we can start to have a little bit of return of vision. That is very uncommon in the older dogs, but sometimes a really young one, like I mentioned, some Cocker Spaniels may have cataracts before they're 1 year of age. They might actually spontaneously resorb these cataracts and get some vision back. What are we going to do for cataracts? Well, there's all kind of stuff on the internet. If you put anything in Google, you get lots of stuff. All these drops and medications that promise to resolve the cataracts. And there's all kind of nice pictures. I just pulled this off the internet, where you have a cataract there and no cataract here, but guess what? This is a really tiny pupil. So maybe it's just the pupil that is here constricted. I don't know, but what I do know is there's a couple products that have been studied, and none of them have proven to have any significant effect. So that's what I typically tell people. It would be great if they came up with something, but no. So what are we going to do? Potentially cataract surgery. Now there's two things. The eye has to be a good candidate. Like I mentioned earlier, if I have a lot of corneal scarring and I cannot see through it, I can't do surgery. So it's very good, important to get a good, thorough ophthalmic examination to determine if that eye is a candidate for surgery. And the dog has to be a good candidate because they're going to need eye drops 4 times a day for several weeks, and then slowly decreasing over several months. They're going to need medications by mouth. And if that's a struggle for every single drop, no, then don't even bother. So we are going to meet Niles. This was Niles, a little dog that had cataract secondary to diabetes. And Niles underwent cataract surgery. Now, before we do cataract surgery, there's a couple things we have to do. The first thing we do is we do an electroretinogram to make sure that the retina functions normal. Because if the retina behind the lens doesn't function normal, taking the lens out is not going to help. So that's the very first thing we do. And this is typically what we look for. It is, we want to see a nice big wave like that. That's good. We don't want to see a solid line that goes like that. We don't want that. And my boy is showing how we do that. It is either no sedation or very light sedation. It's not painful in any way, but they have to sit still. So some of them that are too wiggly, we may have to give just a little bit of a sedative. But we sit with them in the dark for about 15 minutes to allow their eyes to adjust to the dark as much as possible and to become as sensitive as possible. And then the equipment flashes light at the eyes and the computer records what the retinal response is. And then we'll know right away whether or not this would be an acceptable candidate for surgery. Another thing we do an ultrasound on the eye to make sure there's not a retinal detachment or other abnormalities. And this is actually an ultrasound from a normal eye where this, I know it looks like just a whole bunch of black and gray, but this is basically the eye. This is the lens sitting here. This black area is the vitreous, and then the retina is sitting here, and you can't really distinguish it, which is good because it's nicely plastered against the back of the eye. That's what we want. What we do not want is this. We have a lens here which has a cataract, and then we have the retina floating around like that. We don't want that, so we do an ocular ultrasound as well. Now, what do we do during surgery? We use a process called phacofragmentation. It's not using lasers. That's a very common misconception. But we basically do the same thing as they do in people, where basically the ultrasound, the cataract's lens is broken up in many little tiny fragments that the machine then irrigates and aspirates and flushes out of the eye. It is of course performed under general anesthesia in dogs and cats. It's not like in people where they just tell you to lay still, you give you a topical anesthetic, and that night you go out to dinner again. Yeah, no, not so much. So what do we do during surgery? Well, this is the eye at the beginning of the surgery. First make an incision right along the area that we call the limbus, where the sclera and the conjunctiva joins the cornea, and make a little groove there. And then we make a little, first with the needle and then with the special forceps, we make a little opening in the lens capsule. And then with this is the phacofragmentation probe. And I basically start carving out this lens. I start removing all the cataract's lens material until it's all gone. And then here we have the hole in the front of the lens that I made. These are some plaques that sometimes happens in dogs where they have little calcium deposits, and there's really nothing you can do about them, but they tend to not bother the dogs. And then if at all possible, I put an artificial lens back in place again. I fold this thing up actually, and then I inject it into the eye, and then it unfolds, and then it sits there, and then of course we suture it up, and then we're done. The artificial lens, it's not always possible to put an artificial lens in. I would say 95% plus of my dogs get an artificial lens. But what happens, as you can tell, we basically open the existing lens, we hollow it out, and then put an artificial lens back inside that capsule again. So you've got to have a healthy capsule that is held in place with little tiny healthy zonules, otherwise I cannot put an artificial lens in. If we can't put an artificial lens in, it doesn't mean that the eye is blind. It means that there is just, if everything goes well, we have far vision but no close-up vision. Aftercare, lots of it. I always say your job starts when the dog goes home, because there's going to be 4 times a day eye drops, and I just collected some of them. This is an antibiotic, this is a corticosteroid, those will always be. Sometimes we also use a pupil dilator, or sometimes If we have a little bit of an issue with pressure inside the eye after surgery, we may need to use this for a bit. But initially we start at 4 times a day, and then we slowly decrease, but they're typically on medications for at least 4 to 6 months after surgery. There are some animals that are on medications for life, not 4 times a day, but maybe like once a day or something. We also send them home with medications by mouth, typically an anti-inflammatory as well as an antibiotic, and those are short courses. So within the first couple weeks, those are done. We also need to put one of those lovely plastic cones on, and it has to be the old-fashioned hard plastic cones. Dogs are way too smart. If you put one of these nice soft cones on, or a donut or something like that, they very quickly figure out how to flip that thing back and then find a nice edge and start rubbing their eyes against it. So that's why it's got to be this old-fashioned hard plastic one. And then aftercare, they kind of need to do this. Keep calm, sleep a lot. That's very good. We don't want them running, playing, jumping. We don't want them playing with other toys. No rough housing, no toy shaking, take the toys away. They cannot have a bath for several weeks as well. They kind of need to be an old dog for a couple weeks, which is sometimes tough, especially in the ones that see right away after surgery. They're ready to go. They want to see stuff. They want to explore, and you kind of have some, well, not yet. Your time will come. Rechecks, we need lots of rechecks. Again, this is Niles on the top before surgery, and this was on one of his rechecks. And it's every few weeks in the beginning, and then after that it's less. But it's typically is once or twice a year after that for the rest of the dog's life, because there is always a potential for complications later. So here we have Niles again, 2 weeks after surgery. I like to see that twice. He was a happy dog. Success rate and possible complications. Success rate of cataract surgery in dogs, we typically say is about 90%. Now what that means, it means that 9 out of 10 eyes get good vision. Not perfect vision, but good vision. But honestly, you have to turn it around, because it does mean that 1 out of 10 eyes, despite everything you put into it, either may never regain vision or initially has vision but then loses vision again secondary to complications. The complication rates of cataract surgery in dogs is definitely higher than in people. The dog eye does not like to have anything performed on it. The person's eye is much more tough and can tolerate a whole lot more than dog's eye. There's also some breeds that we know have not as great a success rate as others, and the Boston Terrier is one of them, where they're much more prone to getting complications. So those would be one of those breeds where you go like, I really probably would not even consider surgery until the dog is completely blind from its cataracts. So. And then there's some minor complications. Sometimes we get a little corneal ulceration, a scratch in the surface, and that can heal just fine with some medication. We typically here at the AMC always keep the dogs overnight, because some of them will get just a transient increase in intraocular pressure, and we need to make sure that we treat that. Both of those things should resolve, and there shouldn't be any lasting things. There's also major potentially blinding complications. And the 3 biggest ones are glaucoma, a high intraocular pressure, retinal detachment, or excessive scarring around the artificial lens. Rare, and then there's always rare things like intraocular infections or severe corneal ulceration. Those are really rather rare. If we talk about glaucoma, glaucoma is a sustained increase in intraocular pressure in dogs, cats, people. The reason why I hesitated for a moment, because it is so much worse in dogs typically than in people. A lot of times glaucoma in people can be fairly easily, and I guess I should not say that because in some people it cannot, but in a lot of people it can be controlled with just medications once or twice a day for a long time to come. Glaucoma in dogs can be much tougher to control, meaning that the chance of them actually losing vision to it is much greater than in people. Because what a glaucoma does, it damages the optic nerve. And it's not only blinding, but it's also painful. So even if we lose vision, we still have to do something about glaucoma to make sure that that eye is comfortable. Another thing that can happen is retinal detachment. We always check to make sure it's not a retinal detachment before surgery, but it can still happen after surgery as well. Retinal reattachment surgery is possible in dogs. This is not a painful procedure. This is not a painful complication. It can be blinding, but it's not painful. And then if we look at this, every dog will develop some degree of scarring of its lens capsules after cataract surgery. It usually does not interfere with vision. That's why in a lot of dogs after surgery you still see some little white spots, and that's okay. It doesn't bother their vision, it's just some degree of scarring happens in all of them. In some of them they get excessive amount of scarring, and if you get a lot of scarring then vision may be impaired by it. I must say it is more common to get excessive scarring if people just don't bother about giving the eye drops than if they're very good about it. That's one of the reasons why I always stress the aftercare, because it is so important. And cataracts in cats. Cataracts in cats, like I said, a lot will be the same whether you're a dog or a cat, but there's some differences as well. Remember, in dogs, the number one reason was something in their genes. The number two reason secondary to diabetes mellitus. And then the other reasons come way further down. In cats, the most common reason is chronic inflammation of the iris, called anterior uveitis. Hereditary cataracts, I see them, but it's much less common in cats. It's really quite rare. I mean, I maybe see one cat a year. So it's very, very uncommon. Like I said, chronic inflammation is usually the reason for a cataract in cats. It's often just in one eye, and the other eye is completely fine. So for that reason, we don't do surgery as often as we do in dogs, because a cataract, if it's just in one eye in a cat, you would hardly not know that there's any issues with the cat. I mean, they still jump on top of the refrigerator, even with one functioning eye. So we don't do cataract surgery as often in cats as we do in dogs. But surgery itself is similar. We do the electroretinogram, we do the ocular ultrasound, and there is an artificial lens specifically made for cats. We have a dog, we have various dog artificial lenses, and then we have a cat artificial lens as well. The aftercare and the rechecks are the same for a dog or a cat. And I'd be happy to answer any questions.
So thank you very much, Dr. Vander Woerdt. We're going to take some questions, but I just wanted to share, as I was coming up here, I was talking to one of the vet techs in the elevator, and she said, "What's going on tonight?" And I said, "We're talking about cataracts with Dr. Vander Woerdt," and she said, "Oh, that's my favorite surgery to be there for in our recovery area, which is called the beach." She said, "Because you're holding them as they're waking up, and you can just see in their faces, they can see again, and they look so happy and so excited, and usually they don't want to run around right after surgery, but these animals, after they have their cataract surgery, that's when they're most excited." So she said, "That's my favorite," and she got so excited talking about it. So I just wanted to share that. Kimberly, if you want to just hand me a question so we can get started. I know you're going to sort back there. Just do a little random first. Okay. A question about cloudy eyes and cataracts in rabbits.
Ah, good one. Cloudy eyes and cataracts in rabbits. Rabbits are a different story again, in that a cataract in a rabbit is not uncommonly associated with a bug called E. cuniculi. And you have to test for that first and potentially address that. Cataract surgery can be done in rabbits, but it is one of those things where anesthetizing a rabbit certainly has its risks. There is no doubt about it. So if it's a cataract in just one eye, we're less likely to want to pursue it than if it's in both eyes. But yeah, the rabbits are a very different story.
Thank you. We have two questions here about, do you perform surgery on both eyes at the same time or on only one eye at a time? Wait a little bit of time? How do you usually go about that?
If both eyes are affected to the point where they interfere with vision, I do them both at the same time. Because that way, which is very different from people, but that way we only have one anesthesia, we only have one time all the rechecks, and whether you give a drop in one or both eyes, it's the same amount of work. So yes, if both eyes are affected, we do them both at the same time.
Is there an age limit for surgery? Is there a cutoff where you don't recommend surgery?
Nope. It all depends on the dog. I think the oldest I've done has been 18 and a half. No, that's not common, but there is not necessarily a cutoff. Of course, as they get older, we do have to make sure that everything else is okay. So it is more important to do a good physical examination, routine blood work, maybe radiographs of the chest to make sure that that is all in order. But yes, I mean, just the fact that the dog is 15 or 16 does not tell me like, oh no, we can't do surgery on that. No.
Wonderful. Can cataracts be diagnosed during the first visit to the vet?
To me or to a regular veterinarian?
To you, to an ophthalmologist.
Yeah. Oh yeah.
Okay.
Yeah.
So usually the process is you see the general vet refers
Correct.
to someone
Correct.
like you.
Or you might have noticed yourself that you notice a difference in change in vision as well as cloudiness. You go, you know what, I'm just going to have that checked out. And then indeed you would come, or your veterinarian would send you, and that's at that point in time I'll tell you, don't worry about it, this is just an aging change versus, yeah, we're starting to get some cataracts.
Is discoloration in one eye, such as partially blue, partially brown, an issue? Does this mean they're predisposed to eye issues?
Nope, they're not. It's just cute.
Can you grab them?
There are certain eye conditions that are a little bit more common in like the blue-eyed dogs, but generally speaking, if it's just a dog with a blue eye and a brown eye, the vast majority of time that blue eye is just fine.
We have one question here. We've heard that Havanese are prone to cataracts. Is this the case? And are there any preventative measures they can take?
That's a good question, actually. 20 years ago, when the Havanese was a very, very small breed, I saw a lot of cataracts. Now, through a lot of good breeding, I would say the incidence of cataract has significantly decreased. There's definitely still cataracts, but I see cataracts in just about any breed, but not nearly as much again as like 15, 20 years ago. Can we prevent it? If a cataract is going to form, it's going to form. There's nothing we can do to prevent it. The prevention truly is to try to get the dog from like a good breeder that's really focused on trying to make sure there's no cataract in the line. Doesn't mean that a cataract may not come, but it just makes the chance less.
And does the success rate for treatment of surgery differ by breeds? Do some breeds do better than others?
Yes, there are some breeds, and especially the Boston Terrier, where I'm just always more cautious about success rate. Other than the Boston Terrier, in my experience, there's not that many other breeds in which I would be concerned about. But the Boston, yes, I'm concerned.
Can you perform surgery on a dog with a heart murmur? Is that allowed?
It all depends. Can everybody hear the questions, by the way? Okay. It all depends how bad the heart murmur is. Just this afternoon, I did cataract surgery on a little dog with a small heart murmur. Our cardiology service did an echocardiogram, and yes, the murmur is definitely there, but it was not significant for the function of the heart. So at that point in time, it was not an issue at all. There are, of course, some heart murmurs that are associated with significant heart disease, and then cataract surgery or general anesthesia in general may not be recommended.
Can congenital blindness be cured in dogs or cats?
Congenital blindness is rather uncommon, and it all depends what the reason for it is. I would say I can't think of a single thing that would make an animal be born blind that I could cure. Because if an animal is born blind, that usually means there's a lot of different things wrong within the eyes. So it's fortunately uncommon for that to happen in both eyes. It's more common for one eye to be very abnormal and blind from birth and then have a completely normal opposite eye.
For long-haired dogs and cats, should they always have their hair away from their eyes? Is it good to keep them trimmed to avoid any scratching?
I think so.
Or?
Yeah,
Okay.
I think so. I definitely think so. Keep those hairs around his eyes short so that they don't, because they can actually get so long that the hairs turn around and they poke right in the eye. So I love the little bows on top of the head. Anything to do to keep these hairs out of their eyes, yes.
Have you ever seen macular degeneration in animals?
Actually, animals don't have a macula, so no.
That was an easy one. Are you more likely to recommend surgery if there is bilateral cataracts?
In the end, it's always the owner's decision whether they would like to pursue surgery or not. If there is cataracts in both eyes, then the reason to want to do it is stronger than if there's a cataract in one eye. But sometimes we have a cataract, let's say we have a 6-year-old dog with a cataract in one eye, and the other eye is completely normal. The other thing about cataracts and cataract surgery that I did not mention, there is definitely kind of a window of opportunity. And the reason why I say that, as the cataract is in the eye, certain things start happening, and secondary to that, the success rate starts to decrease as time goes on. So if we do, and that window is much shorter in the diabetics than in the non-diabetics. So if I have, for instance, a 6-year-old dog, cataract in one eye, completely normal other eye, we have either basically one of two options. One is to do surgery, one is not to do surgery, and there's reasons for both. The reason not to do surgery is because the other eye is totally fine. An animal can function very well with one eye. Of course, they would like to have two, but they can function very well with one eye. And the good eye may never get a certain cataract. The reason to do surgery is because if all goes well, then we have vision in both eyes again, which of course any animal would like. And also a reason is this dog is 6 now. It's probably an okay candidate for anesthesia. It is still healthy enough that we don't expect much unusual complications from that. What if the other eye develops a cataract when the dog is 12? If we've done this first one and everything went well, then we have vision in this one. And then maybe if the dog develops a cataract when it's much older in the other eye, then at least we have vision in this eye. So like I said, there's reasons to do surgery and there's reasons not to do surgery. And in the end, everybody has to decide what's right for them.
Are there any vitamins or supplements you recommend for animals to just have good vision, to keep their eyes healthy like there are for people?
Nothing in particular.
Okay. We have someone who's asking about, I think this is a medication called lanosterol.
Mm-hmm.
Have you heard of any research on this? Do you think it's promising?
It is one of these things that I mentioned. Yes, there is some research done on it, and for everything that I've seen, it convinced me that it had no effect.
Okay, good to know. Can the iris get freckles, like brown spots on them?
Yes, it can.
Okay.
And that is something to be concerned about in cats, actually. Because in cats, sometimes these freckles, they can turn into a malignant tumor called a melanoma. It's not so much we worry about in dogs, but that's specifically a cat. So if you have a cat with a nice golden green iris and you start noticing pigmented spots, that would be something to have evaluated.
Okay, we have a question from someone on Facebook who asks, what role does nutrition play in preventing or slowing down cataracts?
It's a good question, and I think any good nutrition is good. Meaning what I'm trying to say, you can get cataracts with certain severe deficiencies. But if you feed your pet a well-balanced diet, then I think you've done everything from diet-wise to try to prevent cataract. Because there's really nothing that's been shown to really decrease the incidence of cataracts, nutrient supplement-wise or anything.
Also a Facebook question. If a cataract looks calcified in a senior dog, is there a recommended surgery protocol?
If a cataract sometimes, remember at some point of time in the lecture I showed a picture of what we call the hypermature cataract, where the cataract started shriveling up. Sometimes you can also get these calcium plaques, which is actually one of the things that I showed in that one picture after cataract surgery. If these plaques are minor, they're not a big deal. If the plaques are more significant, then sometimes we try to take them out during surgery. If the plaques are really significant, then we may have to take out so much that we cannot put an artificial lens anymore.
If you catch a cataract early, is it better to perform surgery while it is still small? And will it grow back if you take it out too early?
That is always a good question. I personally like to wait until I am convinced and the owner is convinced that this cataract is going to progress to blindness. The animal doesn't have to be blind, but I want to be convinced that within time that eye is going to be blind. And the reason for that is I'm very cautious. I have 90% success rate, but there's 10% failure rate. And the one thing I don't want to do is make matters worse. So once everybody's convinced that this cataract is growing, it's developing, it's only a matter of time before the eye's going to be blind, then we can do surgery.
And is it ever too late? Like you've caught the cataract too late and surgery just won't help?
Yes, that can happen. Like I said, eventually a cataract does one and grape turns into a raisin and starts shriveling up. And then secondary to that, you can secondary complications inside the eye. Sometimes the retina starts degenerating. So yes, there is definitely this window of opportunity where if you wait too long, it may no longer be a candidate for surgery.
All right, so we're going to have one more question. How do you determine the visual acuity in dogs and cats?
That is very difficult, and truthfully, we can't. There are certain, we can do a technique called retinoscopy, where you basically refract a dog or a cat, same as they would do in people, but still we can't. There's, in research setting, there are certain like navigational devices that animals can like choose, so they can pick and choose, so you can kind of assess vision, but there really is no great vision testing in animals. It remains fairly crude.
Wonderful. Well, thank you very much, Dr. van der Woerdt, for your time.
You're welcome.